Hello everyone, how are you doing? My name is Dr. Karen Hargett. I'm a pediatrician based in North Carolina. Welcome to the Hargett Heartz channel. The goal of this video is to definitively answer the most common questions regarding COVID-19 in kids information reboot. For those of you who may not be familiar with my face and or channel, the goal of the Hargett Heartz community is to provide concise, informative, non-technical, yet engaging, I hope, general pediatric information in order to empower and assist you in making the best fact-based decisions for your child and your family. Think of this channel as the last 10 minutes you really could have used at your last doctor's visit in order to ask those burning questions. Now let's get right into the love fest. The following information is a snippet of a Zoom interview that I did with Own Real Estate based in Maryland. They have an educational series on different topics, but of course during this pandemic season, which has been most of 2020, they included COVID information in their series, and this particular weekend they did COVID in kids. You'll see it abruptly start. It's probably going to abruptly end, but I have condensed it so that it ends up being a 2 to 3 part series where the information is easier to digest. So enjoy. If you have any questions, put it down below. Make sure you subscribe to my channel, like my page, and hit the notification bell so that you know when I upload new videos. I plan to upload every week. COVID-19. What is it? COVID-19 stands for coronavirus disease 19. It's a disease caused by the novel or new coronavirus that emerged in December 2019, first reported by officials in Wuhan, China, to the World Health Organization. So that's where that terminology comes from. So COVID-19 is the actual disease. The virus that causes the disease is called a coronavirus. It's in the coronavirus family. So it's called the coronavirus because the structure has like little tentacles that form a crown around it, and crown equals corona, like in Latin term, the genealogy of the word. People say novel coronavirus, and novel just means new. New to us, new to our ecosystem. No one in this world's bodies had ever been exposed to it before, so we didn't know how to handle it. But the official name for this particular virus that is wreaking havoc is SARS-CoV-2. As of 10 a.m. on this Saturday, June 6th, today, in the world, there was over 67 million world cases and 396,000 deaths. And in the US, it's almost 1.9 million, over 109,000 deaths. And that's as of 10 a.m. And I say that because Johns Hopkins updates the information every 15 minutes. So that is just really, it's just really mind-blowing.
Well, I'll piggyback on the terms you just shared and just ask, when COVID-19 first came about, it was often compared to our regular flu and influenza season. So how is COVID-19 different from the flu, from what you know today? And will it eventually be as common as the flu?
So that's a good question. I'm glad you asked that, because I meant to say that there are several coronaviruses that already existed in our ecosystem for decades. And some of them even cause the common cold. The common cold is caused by multiple viruses, but a coronavirus is one of those viruses that can cause the cold. So it was compared to the flu because of what you saw as a broad perspective as the way it was transmitted. You know, it caused pneumonia, like the flu can cause pneumonia. It's transmitted from person to person by droplets. So that's where the initial comparison came from, until more and more research came out. And I have to say that a lot of our initial research depended on what other people told us, because it began in China, and then its route to the US was by way of the United Kingdom. So we really are just kind of at their hands in finding out the information, and you know, they're scientists, and what are they looking at, or what kind of trends are they seeing in their children or their population. So how is it different from the flu? First, it's a different category of virus, and the way it tries to infiltrate the body is different. And let me just preface this with saying that not much is known, or not enough is known to make final conclusions. So that's why when you ask someone a question and you get answers, it seems kind of hedgy, but that's because we really need the benefit of time to gather the information. And also we need testing to know where we are as far as accurate percentages and symptoms and presentations and things like that. But the one thing that put us into isolation mode quicker than we would the flu is because the prevalence of deaths were quicker within a short period of time. This thing that we don't know anything about, our body newly exposed to, doesn't know how to fight it. We don't have any immunity, no defenses. We needed to do something to kind of try to stop it in its tracks. And that's where the isolation or quarantine or social distancing came from. But we know those methods because of public health. That's what we usually do or try to encourage people to do anyway with the flu. So we want them to wash your hands for 20 seconds with soap and water. That's the preferred way. And if you don't have any soap and water where you are, then you use hand sanitizer with at least 60% alcohol in it. But the infectivity rate of the flu is kind of like 1-to-1. So it's like if I get it and somebody's standing in front of me, they get it, and then so on and so forth. But with the coronavirus, its infectivity rate is so far known to be 2.1. So in other words, I get it and people are standing in front of me, 2 gonna get it, and then 2 people in front of them are gonna get it, and it just spreads exponentially.
Well, you started talking about one of the other questions, which was the precautionary measures that we can take to protect ourselves and especially our children. I continue to hear that washing your hands is still like number one.
Yep.
So, but after that, any other things that you would suggest, especially for children who are, more prone to touching things in their faces and things like that?
Yep, you're right. Number 1 is wash your hands. And with the face touching, it's just kind of being vigilant and encouraging children to wash their hands frequently, especially after they touch something else, or if they have any secretions or anything, they may have a cold or allergies or something going on, but wash their hands. Just, think logically, wash your hands if you touch something dirty, basically. The second thing is wear a mask if you are to go out. Now that has a caveat because it's not recommended for children 2 and under, or anyone that has any respiratory issues. So, and that's a matter of functionality. We want to put masks on children that are able to take it off. And I know that seems counterintuitive because they probably will take it off, but we don't want to not know that they're in distress or something happens and then we have another issue going on. But masks are not recommended for children 2 and under, but they are recommended for everyone else. The other thing is wait. So I'm saying 3 W's: wash your hands, wear a mask, and wait 6 feet apart. And that's because the coronavirus and the flu virus actually are known to have a distance spread rate of about 3 to 6 feet. And probably more like a standard of 6 feet for the coronavirus. I did see a news program that showcased, they did like an experiment, you guys may have seen that. When someone sneezes, it can project to up to 12 feet. And so they were kind of showing the efficacy of wearing a mask because it creates that barrier and keeps your droplets to yourself. And on the other end, it protects people around you further if anything was to escape. So the risk or the possibility of transmitting the virus if both people involved have on a mask is, closer to 0. So my thing is that this coronavirus thing is a risk game.
And I want to definitely, since you focused on one of the big questions for me is the mask. So with the mask, are there particular types of masks that are better than others? You see some people with the paper disposable mask, people are making cloth masks, some with filter pockets, some without. So what masks are best for parents and children, and are like the filters recommended? And if so, like what kind?
Good question. Masks are recommended in like a cotton blend, a tight woven cotton blend, and I recommend that you double layer it, and that is so that any pores or anything in between there would be covered. What are the odds that you lay cotton material on top of each other and they have the same, point of entry or the point of exit. So cotton fabric. As far as filters, I will say the recommendations now are based primarily on accessibility. This is why the masks are being used in a different way than you may be accustomed to people using it in the hospital. Like in the hospital, they use, used to use the surgical mask, the flat ones with the pleats in it, and use it once per patient and you throw it out. That's good infection control. But because we have, I won't say a paucity of material, but in comparison to what we need on a daily basis to combat this virus, we don't have enough. But as far as protecting yourself, it's shown that the mask may have a 76% blockage rate because of the size of the droplets of the coronavirus and the point of entry into like cotton material. It's a 76% chance that you'd be able to not spread it. And when they say the N95 mask, that 95 just means that it filtrates 95% of the particles.
Okay, so as opposed to the 76% of a cloth mask, it's 95
right.
For those.
Right, and so logic would tell me that placing a filter in would be beneficial. Of course, not many studies are shown because we need the benefit of time to go through the experience in order to get data from a study. But it would make sense to me that if you put a filter in, that it would increase from 76 to whatever that would be. It may be 95, it may be somewhere in between, but I don't feel like I should recommend a filter in, only because of societal reasons. So people will try to get filters basically by any means necessary. And if you have something that's a pure filter, I probably would be safe recommending that. But if you have something like you're making something from HVAC filter or any other kind of vacuum cleaner filter, sometimes they may have particles in them or something else in them that we don't want to breathe in or that we don't want our children breathing in. So just to err on the side of caution, I would say unless it's just a pure filter, not made with any metal or charcoal or anything else. Charcoal is a good filter. However, we don't want to be breathing it in, and we don't know what the effect is as far as suffocation factor, I'm going to say. So because the purpose of the mask is to cover all the open orifices that you have, all the windows into your body. So that means your nose and your mouth and your eyes. And that's why a face shield is important also.
Is it okay to use a coffee filter?
I've heard that too, and I think it is because one, it has to be food grade to be a coffee filter, and so it is known to be made for us to ingest something or get something inside our body. So I would say coffee filters are a good filter. What additional effect it has, I don't know. I don't know the pore size of the coffee filters. If they are smaller than the pore size of the material that you use, of course it'll be more effective. But if they're bigger, it won't make a difference. So studies haven't been shown in that, but I would say logically, to me, it would be beneficial, more beneficial than not.
Thanks for joining me with my COVID and Kids question and answer Zoom interview part 1. As you can tell, the information is still relevant today. 4 months later, we still have not gotten control of coronavirus 19. So stay tuned for more questions back 4 months ago that are still just as relevant today and what to do about this disease.